How many patients worldwide have been treated with?
So thus far, approximately 200,000 patients have been treated with the technology. Today, I might point out that only 5 of these 100 indications are FDA approved. So about 200,000, more than 50,000 last year, and the number of patients that have been treated or will be treated is increasing exponentially. We're just at the beginning point of the inflection, or the inflection point of the adoption of the technology.
John, you say that the Tumor is the most important book you've ever written. How did it even come to your attention, and where did you get the idea for writing the book?
Well, I'm on the board of the foundation. Neal and I both live in Charlottesville, Virginia, which, in spite of what you may have heard in the past year or so, is a really wonderful place to live. I've been there 25 years, and I've not seen or met a single neo-Nazi, skinhead, or white supremacist. It's a great town, okay? Neal has been there about 35 years, and we've been friends for 20 years. And Neal is my personal brain surgeon. He hasn't gone in yet, but he works pretty cheap. I keep him on retainer. I buy him 1 case of Italian wine per year, and that's his retainer. So he's always on call for brain surgery. And so he's also helped me with a number of other medical problems over the years, which we will not discuss. About 10 years ago, Neal stopped doing a lot of surgery and became focused on Focused Ultrasound, the foundation. And he asked me to join the board. And I said, I know nothing about medicine or medical research or devices, and that's not where my interest is. I mean, I'm a lawyer. I write about lawyers and law firms and trials and litigation, and normally when I go to a convention like this, it's a bunch of trial lawyers conventions where they're trying to figure out new ways to sue people, and I really enjoy that kind of dialogue. All right, so I'm kind of out of my element right here. Neal asked me to join the board and to try to help him raise money and raise awareness, and I joined the board, and I said, I'm not going to help you raise money because I don't like to do that, but I'll try to help raise awareness. And over a period of a couple of years, we had the idea. It started off almost kind of as a joke for me to write a book called The Tumor. Obviously, I have a lot of trouble with titles because they're not very original. But we said, okay, The Tumor, make it a non-legal thriller, and the story just kind of evolved. It was easy to write because it's a short story. I was intimidated by the medicine, so Neal had to edit every draft. It took us about a year to get it done.
Well, I tell you, it's a great and quick read, honestly. It's fascinating. I urge everyone here to get that book. It is free. I even see my brother's back there shaking his head in agreement, which is awesome, because my brother's never even come to hear me speak. But I want to use both of you now to out one other person who's a legend in this industry, who's central to this story as well, as Bill Crutchfield. What's his role? Bill Crutchfield, the Crutchfield Corporation, the Crutchfield Catalog. I know he hooked me up with you two. But other than that, why is he involved? What's his connection?
Well, I have to give Bill a lot of credit for helping start the foundation, because 11 or 12 years ago when I first came across Focused Ultrasound, my idea was to create a Focused Ultrasound center at the University of Virginia, just like we had done with the Gamma Knife. And we had commitments from a number of people to help buy the equipment, et cetera, et cetera. But the university was dithering and prevaricating, and nothing was happening. And Bill was on the board of visitors at the time. And I was talking to him about my frustration, and he said, why don't you start a 501c3, take the money from the people who want to commit it, let the university go ahead and dither, and go ahead and progress with your plans. And that's what we did, but it took about 1 week to appreciate that while the university fiddled around, we didn't have to wait. We could do things around the world. So talk about luck. If the university hadn't gotten in the way, and we would have had a fine center at UVA, but the field of Focused Ultrasound never would have developed as it has as a result of the success of the foundation.
But Neal, it's still a great university, right?
UVA is a great university.
Get those talking points down, Neal.
Right.
So, Neal, how did you even come up with Focus Ultrasound? How did the idea happen?
Well, it's not my idea. What happened was that about 12 years ago, I was very frustrated trying to find a new treatment, a non-invasive or minimally invasive approach to treat a number of patients I had who had brain tumors in surgically inaccessible areas or who had tumors that had failed surgery and radiation and chemotherapy, had maxed out. And at the same time, I was doing research using ultrasound to measure blood flow in the brain. And I can remember specifically exactly where I was when I was driving home one day, and I said, I'll bet we could use ultrasound somehow to treat these otherwise untreatable tumors. I got really excited and I raced home and I said to myself, you know, after doing research since 1962, I finally have a Nobel Prize winning idea. And I was really psyched. I got home, I went to the internet and discovered that it was a Nobel Prize winning idea, just wasn't mine. Okay?
But you're making it happen.
Right, so then I brought together people from one of the manufacturers and people from the university and the community, and that's how we got the idea to start the center.
Thanks. John, you wrote this book. Have you gotten any response from anyone? Has anyone written to you about it? Has it affected anyone's lives? And if the answer is no, it was a bad question.
No, well, yes. The answer is yes. We've been very pleased with the response. Been very pleased. Seriously, what I hope we would do, I hope the book would get enough attention that it would be read by people who have the capacity to make big gifts to the foundation, because it's a small foundation. It's driven by research. We have a wonderful staff. We have a nice board and all that kind of stuff, but we need cash. You know, we need donations. All of our money's private. It takes about $10 million a year, but it's all research. And the more money that we have for research, the sooner this technology will be available, and the more lives it will save. So we've had several donors so far who were inspired by the book and wrote us a check. That's what we're hoping for.
So,
by the way, I haven't won a Nobel either. I don't think either one of us will ever win a Nobel. But see, Neal thinks about the Nobel Prize. I wrote it off a long time ago.
well, after I read the book, I was convinced both of you deserve it, because the amount of maladies it could potentially treat and is already treating is huge.
Yeah.
And it's a fundamental change in medicine. And to me, it was taking a treatment of chemotherapy, which is debilitating, or surgery, which is, the way you describe it is so vivid that it scared me. I would start with ultrasound.
You should have seen the first draft of the book. The first draft, Neal collects all these gory photographs of brain surgery. There's a lot of blood and close-up pictures of the blood and gore. He loves that kind of stuff. I kind of like it too. But we were going to put that in the book to really shock people, and it shocked even us, I think, and the staff said you can't do that. So we had to use cartoons and graphics and tone it down. But the first draft was probably R-rated.
Yeah.
Well, thank you for the edited draft. We appreciate that. So, Neal, there are people here live, and there's people watching streaming who probably know somebody who say, wow, this might be right for them. What do they do to find out about the treatment, to get more information? How do you get plugged into ultrasound? How do you even talk to your doctor about it?
Okay. So let me take it up a level. One of the major impediments to the adoption of the technology is lack of awareness of what people have called medicine's best kept secret. So one of our goals is to increase awareness. Being at this show has done more than anything it could possibly. So
Wait a second, you were with Vice President Biden when he was still vice president, and he was in charge of cancer, and he was giving you some attention and love, and said you were the most significant thing that he was focusing on.
Well, that was true.
But I think you're just flattering me, but keep going.
Yeah, right, exactly. I need a lot of that.
Biden told a lot of folks that, I think.
Yeah, right. So bring it on. Anyhow, So the best thing to do is to go to the Foundation's website, which is fussfoundation.org, or just Google Focused Ultrasound Foundation. And there is a discussion of every one of the 100 indications and where they stand in their development. And there's also a listing of the now 550 treatment sites around the world where you can be treated, of which maybe 150 are in the US. By the way, out of a potential market worldwide of about 10,000, because it's still early.
So this sounds great, but are there any negatives? Are there any side effects to the treatment?
Well, first of all, yes, there have been, just like any therapeutic technology, if you point, put the target in the wrong spot, you're going to create damage. And there have been some technical failures, there have been treatment failures, and to be sure, there have been complications. Having said that, the complication rate, or the adverse effect rate for focused ultrasound, is less than any of the standards of care today. But one of the challenges is here we've gone from, in 10 years, from 3 clinical indications to more than 100. And how do you figure out where focused ultrasound is going to have unique value in terms of decreasing death and disability and suffering and cost of care? And I have to make it clear, this is a little bit of a disclaimer. So focused ultrasound is not for every patient, it's not for every disorder, it's not a panacea, and it's not a silver bullet. But it does have the ability to revolutionize therapy and improve the quality and longevity of life for millions of people. But there's a lot of work left that has to be done to sort this out. There's got to, there's more research and development and clinical trials and patient experience.
Also, Gary, Neal says we have 100 applications. Most of those are still in the development stage or research stage. Only, 5 or 6 have been approved by the FDA and can be used now. So we have a lot of work to do. When I joined the board 8 years ago, there were 3 applications: uterine fibroids, bony metastasis, and prostate cancer. 3. Now we have 100 potential. Our job as the foundation is to drive the research to get all 100 approved. It's going to take a long time and a lot of money.
So what I'm hearing is this is not a cure-all, but it's a cure-a-lot. And more research is necessary to figure out for each different malady how effective it is, or maybe even how it should be done or not.
Exactly. So there's still some technical development that has to be done, but mostly that's engineering. The heavy lifting's already been done. It's really more and more clinical trials, long-term follow-up of these patients, and so on.
So, and I understand that there's different companies which make the equipment.
So today there are 52 manufacturers of the equipment. 10 years ago there were 5. So some of them have different applications, like one will do prostate, one will do breast. But the fact that there's so many companies is a really healthy indication of the viability of the field. And there's a pioneering company called Insight Tech that I was on the board of for some years ago. And there was a press release recently where Coke, their new Coke Disruptive Ventures, just invested $100 million.
Coke Brothers, not
Coke Brothers.
Not Coca-Cola.
Not Coca-Cola. No, not Coca-Cola.
The intellectual, now I understand you own intellectual property as a foundation, but you license it freely, is that correct or not?
Well, any intellectual property that the foundation develops, we put in the public domain quickly so that everybody can access it, it doesn't get locked up. But the vast majority of the IP is owned by these manufacturers. A good bit is licensed from academic institutions, and a whole lot of it is developed with the funding from the foundation for the research programs.
So to make it very clear, this is not a money play as opposed to the 4,000 other exhibitors at CES, where they're here to make money. You're here to get people healthy.
We're here, our role is to improve the lives of millions of people. Our organization is 100% patient-centric.
And when a patient goes in, what does this typically cost them? And the next question a patient would ask is, does my insurance company cover it?
So the greatest impediment today to the success of the whole field is lack of insurance reimbursement, but that's coming. So we've got FDA approval, and then eventually it'll get insurance reimbursement. But to put some numbers on it, for uterine fibroids, a hysterectomy, all in, doctor and patients, $20,000 to $25,000. A focused ultrasound treatment is $5,000 to $10,000. Parkinson's disease, the standard of care, the gold standard is a deep brain stimulation, all in year one, maybe $60,000 to $100,000. Focused ultrasound, $30,000. So this is an unusual technology that fulfills the holy grail of not only improving outcome, but decreasing the cost of care.
And also the impact on the patient. So I understand if I have a brain tumor, I could do chemo now, I could have surgery, and both of those are over time and
Right.
it hurts. But with your treatment, if I have a brain tumor and I go in, could I go in as an outpatient and drive home 3 hours later?
It is outpatient. You drive home.
Yeah, drive
You
home.
drive home yourself.
You cook you cook the tumor in 2 hours and you drive home. Or maybe your wife drives you home because you had a sedative, okay? But there's no incision.
We have a time for a question. If there's anyone from the audience who has a burning question. Anybody? Yes. Did I see you raise your hand back? No, you were just contemplating. Okay. Well, is there anything else that I should have asked that I didn't ask? Oh, we have a question right here. Wait for the mic. Oh,
okay.
I'm sorry.
Yeah. One quick question. In order to get reimbursed by insurance, would you have to have the chemotherapy?
No.
Right here is the question.
I just want to say the book was well written. I am a 2-time cancer survivor.
Close to your mouth.
I'm a 2-time cancer survivor. First in my large B-cell lymphoma, first in my sinus, then on my brain. They couldn't do any kind of surgery on it, but I got to a hospital that saved me, U of M, and a great doctor. But I love the book. I love what it's doing, and keep this going. This is very important that this stuff gets out there, and it gets read, and it gets more and more people involved, because I wouldn't have been alive if this had happened to me 10 years ago. And I've been in remission now since 2015.
Wow.
And I love every day of my life. I love my wife. I love my 4 boys. I love everything. I used to be a vice president for a company out of the Midwest, and I came here for 11 years. Then I had to fight cancer for 4, get better for 2, and now I'm back. And I wasn't supposed to be alive. That's the crazy part of it. But I'm here, and I read that book, and it's exactly true. And please make it a bigger thing. It's great it's here, and it's going to get bigger and bigger, and please keep it going. And I go by, just really cheesily, it's a phrase I used when I was in chemo at U of M, and I used it in the physical therapy I had to go through, speech therapy I had to go through, and then the first try I did, and the first half Ironman I did, and the second half Ironman I've done, the third half Ironman I've done, and it's go, go, go. And just keep going.
Well, thank you. And congratulations. And as far as the foundation's concerned, it's not going to go away. We're not going to stop. He's committed. It's his foundation. He has a great staff. We have a great board. We have a great network. We have great donors. Not enough. We need more, but we're committed for the long haul.
And on that note, I thank you for sharing that with us. That was absolutely terrific. Did you want to say something? I was about to wrap it up on that incredible emotional note. So you got to match that.
For the doctor, I have a question. Does the focused ultrasound have any application for Alzheimer's disease?
Great question.
A great question. Let's see if I can remember the answer. So, so one of our really important research areas for this year is Alzheimer's disease. And the very first baby step in terms of clinical trials has been accomplished, and it was successful, and it was just proof of concept to show that you can open the blood-brain barrier to allow drugs in that are otherwise excluded. So this is a red-hot area for us. I think focused ultrasound in Alzheimer's disease is a long shot. Having said that, 350 drugs have failed clinical trials. It's going to take a Hail Mary to make this work.
I appreciate that answer. And I appreciate both of you coming here. I think you are world heroes. And in terms of people, reporters have asked me, what am I excited about at CES? And though I really love the technology and everything, I think what you're talking about is as significant as anything I've ever seen in my lifetime in terms of changing human pain and suffering and healing people. So I wish you the best. You have my support. Let's hear it for these two heroes, folks. Thank you.